Welcome back to Morning Live. A new treatment using a laser has been approved to treat cellulite. Plastic surgeon Dr. Sean Rice joins us now from Rice Cosmetic Surgery in Toronto. It's one of the Canadian training centers for something called Cellulaze. And I have to admit, when the publicist first promoted this to me, I'm like, really, another treatment for cellulite? But this one has clinical, and it's been Health Canada approved.
Health Canada approved. You're not the only one to say another treatment for cellulite. The other machines that have been around for a while are really sort of water distribution machines. This is the only machine that's ever been cleared by the FDA and Health Canada to sort of minimally invasive to sort of approve cellulite.
Okay, to remove or improve it. And how does it work? We have some animation actually that we're going to roll, and you just tell me then how it works.
Sure. Well, cellulite is caused by three things. It's caused by thin skin, these little sort of fibrous bands that sort of pull the skin down, and little globules of fat that get stuck between those fibrous bands. So what we're doing now with the laser is we're snapping these fibrous bands. That's going to release the skin, and then we're going to melt little tiny globules of fat underneath the skin, and then we turn the laser on its side, and we use the laser to sort of thermally heat up the skin, and that helps to thicken the skin. So now you're addressing sort of the three structural causes of cellulite, not really just sort of redistributing water. So.
Right. And I like how you actually measure your patients before surgery standing up.
Sure. You stand up. We use a little bit of a grid pattern. It's a 5 by 5 centimeter square. And what we do is we mark off those little bands. We mark off the fat, and that way we can treat everything individually. As soon as you lie down, it's hard to see stuff.
Right,
so you got to mark them sort of standing up.
Okay. So we're seeing kind of the ending process here. Now, if you melt a little bit of fat, why not melt a lot of fat, or is it just not necessary?
Well, you can. We've been combining it with some liposuction on saddlebags and things like that. So the thing with this laser is it's very specific for the cellulite itself. So we use another laser made by the same company to help sort of melt the fatty component, and it works great in combination with the two of them.
Okay. Now, is it painful? Because, I mean, in the animation, it looks like the laser goes in, but does it actually, I mean, is there an instrument that goes in just like in liposuction?
Similar to liposuction, we use a small little punch biopsy. Let's say we went to a dermatologist, they need to biopsy a mole about 2 millimeters.
Okay.
We put some local anesthetic in there, kind of like you're getting liposuction, but a smaller amount, so you're just sort of freezing underneath the skin, and then we go ahead and do the procedure. So we do it a lot of times under local anesthetic. Okay,
and you were saying that you could actually get up and go to work the next day.
Sure,
you're a little tender, but...
Yeah, a little tender. You need to wear a compression garment like a Spanx for a couple of weeks afterwards. You can get a little bit of that fluid that leaks out, but I would say almost every patient's gone back to work the next day.
Really? Really? And you've been doing this since?
Since September. It got Health Canada approval in September.
Okay, now the big question. Cost.
Cost. Cost varies between person to person and how sort of many areas you want to do, but I would say generally it runs you about $4,500 and then up depending on how many other areas you need to do. Okay,
but the results are pretty spectacular. We actually have some before and after pictures here if you could just discuss it. Because it's not always overweight people who have, you could be very, very skinny and have cellulite.
Right, there's no correlation between cellulite and weight or diet or even exercise.
Right.
I did a lady last week in 90 odd pounds who had a lot of cellulite. Here you kind of see the before and after pictures. These after pictures are really about a year down the road. It does take at least 3 months where you start to see the results because it really needs to tighten up the skin and thicken the skin. And it's been shown to thicken the skin by about 30% over a 1-year time frame. So at 6 months, the results start to look great. At a year, they start to look great, and they should last you indefinite amount of time afterwards.
Right, so this isn't a procedure that you get done once and you might have to come back and get a booster or something for it. This is once.
No, this should be a one-shot deal.
Okay, and your website if people are interested?
It's www.drseanrice.com.
Okay. So that's some great ideas there then. And what about health risks for it? You're under a local?
Sure, under a local anesthetic. It can be a little bit uncomfortable putting in the freezing. Because it is a laser, there's a risk of getting a burn from the laser. We've never had anything like that. It can be a little bit sensitive to touch afterwards, and you can get a little bit of bruising associated with it.
Okay, so not something you're going to do just before a vacation, but maybe a few months ahead of time.
Yeah, a couple of weeks at least ahead of time.
Dr. Rice, thanks so much for coming in.
You.
We have more news coming up at 8:30. Stay with us.